Good morning, everyone, and welcome to the State Plan on Aging virtual listening tour. Before we start, I would like to go over some housekeeping notes. All participants are currently muted. If you are joining by phone only and wish to follow along, there is a PowerPoint presentation located on the KDADS website at kdads.ks.gov/2020-listening-tour. Also, I would like to note that Jeffrey Dunlap is our ASL interpreter for today's session. So if you need his assistance, please make sure to follow along with him. My name is Christina Orton, and I'm the Aging Services Director for KDADS. I would like to take a minute to introduce Gabrielle Risley, who is our Older Americans Act nutritionist, and Cynthia Harris, who is the Older Americans Act and Senior Care Act Program Manager. The listening session for the State Plan on Aging is conducted to gather your thoughts on services provided by KDADS Older Americans Act program, referred to as OAA. This event means a great deal for the state of Kansas because it allows seniors to voice their needs and allow us and the Aging Network to develop goals to better serve older Kansans. KDADS, our mission here at KDADS is to protect Kansans, promote recovery, and support self-sufficiency. We achieve our mission through major program areas such as home and community-based services, long-term care, behavioral health services, state hospitals, and nutrition services. These programs provide a wide range of services, including but not limited to aging services such as Aging and Disability Resource Center, so ADRC, Older Americans Act, which is OAA, Senior Care Act, which is SCA, Medicare programs, which include Senior Health Insurance Counseling for Kansas, SHIC, Senior Medicare Patrol, SMP, Medicare Improvements for Patients and Providers Act, MIPA, Client Assessment, Referral, and Evaluation, which is the CARE, and Programs for All-Inclusive Care for Elderly, known as PACE. A little background on OAA. It was originally signed into law in 1965 and established the Aging Network, which provides community social and nutrition services for older persons and their caregivers. Since 1965, there have been many reauthorizations of the Act, including the recent 2020 reauthorization, which is valid through 2024. The Older Americans Act funds services that keep older adults healthy and independent in their homes. In accordance with the Older Americans Act of 1965, as amended, KDADS, as the designated state unit on aging, submits a state plan on aging to the U.S. Administration on Aging every 4 years. This plan describes the agency's vision and purpose, including the goals and strategies to achieve this vision. Development of the plan is accomplished through interaction with the Kansas Aging Network. The Older Americans Act, OAA, is the most comprehensive legislation composed of 7 titles. KDADS administers the grants for OAA Title III and OAA Title VII. These grants are for state and community programs such as supportive services, which include homemaker, attendant care, transportation, case management, and legal assistance. Nutrition includes congregate and home delivered meals, nutrition education. Disease prevention and health promotion includes evidence-based health promotion and disease prevention programs, and The family caregiver support includes respite, counseling, information, support groups, and homemaker services. Title VII are grants for elder rights protection, such as the Long-Term Care Ombudsman's Program, prevention of elder abuse, neglect, and exploitation, and state legal assistance and development program. The purpose of our state plan on aging is to outline the primary responsibilities of planning, policy development, administration, coordination, priority setting, and evaluation of all state activities related to the objectives of the OAA. Kansas State Aging Network shall serve as an effective and visible advocate for older individuals by reviewing and commenting upon all state plans, budgets, and policies which affect older individuals, and providing technical assistance to any agency, organization, association, or individual representing the needs of older Kansans. The Kansas Aging Network shall also assure that preference will be given to providing services to older individuals with greatest economic need and older individuals with greatest social need, with particular attention to low-income older individuals, including low-income minority older individuals with limited English proficiency, and older individuals residing in rural areas. To meet the needs of older Kansans, KDADS administers programs throughout the state, primarily through the local area agencies on aging, also known as AAAs. The Kansas Association of Area Agencies on Aging and Disabilities, known as K4AD, represents all 11 area agencies on aging that coordinate services, assess, provide information, case management, and numerous other services for seniors in all of the 105 counties in Kansas. To learn more about services offered in your area, you can dial the Aging and Disability Resource Center at 1-855-200-2372. The Older Americans Act plays an important role in the lives of older Kansans with services and programs provided through the 11 AAAs, 3 tribal organizations, 165 Title III service providers, and hundreds of invaluable volunteers. In 2019, nearly 33,000 older Kansans were served through OAA Title III registered services such as congregate meals, case management, personal care, home delivered meals, and homemaker. Providers in Kansas provided more than 3.1 million meals, 20,000 rides, and 10,000 hours of personal care to older Kansans. The National Family Caregiver Support Program hosted more than 1,000 counseling and training events and served more than 13,000 family caregivers with more than 35,000 hours of respite care to provide much needed relief. Lastly, the Kansas Long-Term Care Ombudsman's Office provided more than 1,000 consultations to help resolve complaints and issues on behalf of individuals residing in long-term care settings throughout OAA. KDADS Aging Services has developed a survey to gather your feedback for our 2022 State Plan on Aging. We encourage our partners and customers to share the flyer and survey link with older Kansas and caregivers. The survey will be open until the end of March 2021, and your participation is greatly appreciated. While this is the last listening session for 2020, We are still welcoming written comments until April 30th of 2021. These can be sent to KDADS OAASEA@ks.gov or to the Kansas Department for Aging and Disability Services, the attention of Christina Orton, Aging Services Director. This is an opportunity to provide open-ended feedback, comments, and success stories regarding aging services in Kansas. The purpose is not necessarily to answer questions, but to provide an opportunity for public comment and to assess for unmet needs of older Kansans. As we move into the feedback portion of this session, we would like to go over a few housekeeping notes. To provide comments, individuals with computer access may raise their hand by going to your name in the participation list and clicking on the little hand. Individuals with computer access may also type your name and county of residence in the chat area. We will address individuals joining on the computer first, allowing time for individuals on the phone to share towards the end. If you are on the phone and would like to share, please feel free to push *6 to unmute yourself to provide comment or feedback. Please know that the state plan on aging is intended to address seniors' current and future needs related to Older Americans Act services. Your participation will be used to develop upcoming 2022 through 2025 state plan on aging. Please take this opportunity to share suggestions, needs, comments, and feedback about OAA, as well as all or any aging services provided throughout Kansas. Please consider the following questions. What Older Americans Act services are working well? Are there gaps in the OAA and other aging services? What is the most important for you to see in a program serving seniors? What are barriers to services? Social isolation and loneliness are prevalent, and these issues have been exacerbated by COVID-19 pandemic. How can Aging Network address social isolation and loneliness? So at this time, we will go ahead and open it up for feedback. Please raise your hand or chat in the chat box or unmute yourself by *6 if you're on the phone. And as we stated, that any feedback does not necessarily have to be related to Older Americans Act. It can be related to any of the programs within the aging community or any needs that may be identified. Success stories are also welcome. We like to provide success stories to the federal government to let them know we appreciate the funds that they provide, and this is how we have been able to make a difference or impact within Kansas. Also, if you have any questions on what we've went over or need clarification, please feel free to ask for that. We'd be happy to provide any clarification needed.
I raised my hand. My name is Sherry, and I am on from the perspective of my parents getting to the age where they're really questionable to be independent living. And, I'd like to keep them in their home as long as possible. And just, kind of navigating the system and understanding what services are available, what they qualify for, what they don't qualify for, things like that. So, I would just say, making information easily digestible or understandable for those of us that are in that situation. A lot of times the, elderly parents aren't really able to interpret things by themselves. And it's kind of frustrating, but I jumped on to kind of learn, I guess, and hear what other people were saying. But that's what's on my mind right now is just, it's a little bit overwhelming, trying to understand everything. And, sometimes like my parent that's still alive is in another city. So it's, not just understanding what's available in my county, but what's available in that county, and sometimes the information isn't always consistently presented from county to county. And so then you're on the phone calling versus, hunting something down on a website. So to the degree that there can be some consistency on what is presented and how it's presented, that would be helpful. And, one of the things I'm kind of struggling with too is like signing my parents up for, like the Medicare and this Medicare Advantage versus things like that. And then just understanding, okay, well, if hearing aids aren't covered, what are the options to get hearing aids at a discounted price? So that's my comments.
I appreciate that. And if you would like to, if you have the PowerPoint, if you don't, it's located on the website. Feel free to reach out to me and email me because I have staff that could actually probably help you with some of the Medicare. I do know open enrollment has ended as of the 7th, but going forward, that's definitely some questions that we can help you with. And I really appreciate the feedback, especially knowing that you are trying to take care of your parents and it's hard for you to figure out what services are available. So that's valuable feedback. We really appreciate that. Do we have any other comments or suggestions or feedback?
Hi, I have a question, and I had trouble getting on, so I don't know if you've already covered this, but I have a mom that we had to recently move into memory care, and where she lived before, we could see her every day, and we were a part of her caregiving team. Since she's moved into this new facility, we are blocked out now because of COVID. And she's having a really hard time understanding why that is, that we have abandoned her because she doesn't really understand all this stuff. We've been in contact with the facility almost daily via email, or we're trying to do everything we can to see her as often as we can. But my big concern is, we understand how dangerous COVID is, but I'm weighing my mom's mental health and against her, the chance that she will get COVID. They talk about window visits, but you're talking about people who can't hear well, you can't open the window. So I don't see the advantage of her just seeing my face. I think it would be more confusing. So I would just like to see what is the plan for that. And, you know, we don't want this to be a contentious situation with the facility. I know they're trying to just do what they can to keep it out, but there doesn't seem to be very much even this long down the line of creative ways to keep people attached except for FaceTiming. So anyway, that's my comment. That's my question.
Well, I appreciate that. If you don't mind, can I ask your name? Your first name?
Leanne.
Leanne. Okay. Sorry if I missed that. You know, and unfortunately, we are in the COVID pandemic, which has created lots and lots of barriers. I do know that is not a particular area I'm as familiar with, although I have been involved a little bit. But I can definitely, if you don't mind emailing me and giving me a little feedback or information, I can connect you with a couple of people that may be able to kind of help with some of your concerns. I don't know if you have a pen or paper.
I do.
Okay.
I do.
My email address is Christina, so it's CHRISTINA .ORTON2, the number 2, at KDADS.gov. And if you want to send me an email, I can get you connected with some people that may be able to help at least express the concerns that you may have or that you have.
Yes. I'm sorry, I missed at K what?
At ks.gov.
Oh, ks.gov. Okay. Okay. I will shoot you an email and then you can direct me to whoever you think might help. I know I'm not alone in this. And I know because we were very fortunate that we were able to stay with her as long as we could through this, but it's very difficult when, you know, you get on to FaceTime and all she does is cry because she doesn't understand why you're not there.
Yeah, I can't imagine. Yes, well, I appreciate I appreciate the comments and feedback. There is a lot of people going through that, but that doesn't mean that we don't want to hear about it. So thank you. And I'll look forward to seeing that email from you.
Thank you.
Is there any other comments or feedback or success stories that
Hi, this is Teresa Modry, and I guess I kind of agree with both of these past speakers. But I guess my biggest concern is I've worked in the disability world for 26 years. I'm retired now, but I still get a lot of people asking me. I have a sister-in-law who's 65. They just don't seem to be aware of the services that are out there, and they don't have a clue how to navigate them. And I'm just wondering, how can we get that information out? She says, I expected maybe that her doctor would say, oh, did you know this is available or something, and refer her to the Department on Aging. But no, that doesn't happen. How do we better educate people about these services?
That's a very good question, and I'm glad that I have basically 3 of you pretty much saying the same thing. So that's something that as a state we need to look at and try to implement into our state plan. Like, how can we better educate our community members of services available? There are a ton of services available, but I will tell you, I am a social worker, and so I know how to navigate systems, but I've worked with many families that do not.
Right.
That is definitely the #1 downfall throughout all programs and services in most states. I mean, Kansas and other states as well. So we we'll start looking at ways that we as a state can implement and make sure that education is being provided to the community, so that family members, loved ones don't have to try to jump through all these hoops to try to figure things out. So that is definitely something that me and my team will look at putting into our new state plan on aging. See what we can do to educate the community. So thank you for that. And hopefully in the next year or two, you guys will start seeing more communication and education going out from the aging.
Christina, I can chime in real quick. I just wanted to say I really enjoyed your presentation, and I'm really glad for the three folks that have shared today. As Christina mentioned, I am the Older Americans Act nutritionist. I'm a registered dietitian, and I focus on congregate meals and home delivered meals across the state. Most are familiar with Meals on Wheels. I also participate in some networking for creating awareness for food insecurity among seniors and providing better access to food throughout the network with SNAP and food stamps applications, things like that, access to food pantries and commodities. So I just wanted to provide a prompt if anyone has any comments on food insecurity, access to healthy food, nutrition education, topics like that. If you've had any comments on that, that would be helpful as well. And then again, I know some of you have mentioned the struggles with COVID-19. This is a meeting for, long-term goals and feedback on the aging network and services that we obviously realize that we're still in a pandemic and a state of emergency. So we really appreciate feedback on anything that you're experiencing with that as well.
Well, I know my mother does receive Meals on Wheels, and from what I can see, that program is working pretty well, at least my observation. So thank you for your efforts on that.
Thanks. I appreciate that. I'm glad it's working well for her.
I would also say, and I don't really understand the financial impacts of this very well, but, it seems like there's some financial thresholds that drive eligibility, and that there may be a pool of seniors that are slightly outside of that threshold. So over the longer term, really trying to evaluate, are we capturing, are the ones that need services getting services, and do we need to advocate for adjusting thresholds at some point? Because when I was trying to read and interpret what services are available, that seemed a little bit hard to understand. And I'll get with you, Christina, offline, but it just seems like there would be some seniors that really could use some help that aren't eligible. And I know there's a limited pool of money from the state, but that would be my concern is, are there vulnerable seniors that aren't qualifying that, like going without hearing aids or, whatever the services are.
That's a very good point. Thank you for bringing that up. Yes. That's what we kind of refer to. We have some kind of hard to reach populations, and I think a lot of them would fall into that category. So that's definitely an area that we continue to strive to try to figure out how can we reach that population and how to best serve them. So thank you for providing that feedback. And yes, please feel free to email me any additional information. I would be glad to look for that email. Is there, I don't see anything on the chat, but is there any additional feedback or?
I see a raised hand from Marta.
Hello. Hi, can you hear me?
Yes.
Okay, tell me if I'm too loud. I am 66-year-old daughter, caregiver of my parents in Atchison, Kansas. I moved back here a year ago, so this has been a big shock for me to have these changes take place with the virus and affecting my social life. So yes, I think it's great if you're doing some support for caregivers. But my main thing, I want to praise the Kansas people that are helping my parents. I think my mother actually learned about it just word of mouth from some of her other senior friends. My mother's 87 years old now, and my father is 84. They're both homebound, basically, and they are getting the help from. And I wish I knew Shelby's title for sure. With the Northeast Kansas senior group. Very helpful. And they have a great relationship. My mother feels like she can call her at any time, too, if she has a concern. And Shelby is great at checking up on her. My dad refuses to go through the evaluation to accept the help. He doesn't think he needs it. The home caregiver is not really doing anything personally for them other than cleaning and little things like that. But I know that there's a lot more that the caregiver can do. And the price is reasonable, I think, for them. So I really appreciate that, the caregiver. My big concern, Gabrielle, is the amount of protein in the Meals on Wheels here in this county. We appreciate the service. $3 a meal is reasonable, that's for sure. But with my dad being a diabetic and my mother overweight, it's just they're high in carbohydrates, which I realize protein is more expensive. They're finally understanding they need more protein, especially my diabetic father who's had a stroke. So I just wanted to pass that on, that we are concerned about the amount of protein and wishing there was a greater amount in there. I do communicate actually with the those who handle the Meals on Wheels here in Atchison, so they understand too. Marsha Walters, I believe it is. So I just wanted to talk about that, pass that on, because we talk about the Meals on Wheels a lot. Oh, they are very helpful, but I do have to really, I'm 66 years old and I'm trying to take care of myself too and them. And I do a lot of cooking for them too on the side. So I just wanted to express my concern about the dietary balance in the Meals on Wheels. And thank you for the service. But yes, I agree that it'd be great if doctors were giving out this information to people when they see there could be a need. Maybe they're just not informed. But I appreciate it and I thank you.
Well, thank you. We love to hear the caregiving services is going well, and that they're receiving the assistance from Northeast AAA, Area Agency on Aging. And thank you. I'm sure we appreciate the feedback on the protein in the meals, and the doctor's information. That's definitely a good place to spread communication for sure. So thank you for that.
Thank you.
I second that, Marta. I really appreciate you providing your feedback on the meals. It's very valuable information.
Well, if we'll take one last call for any feedback, comments, questions, and if not, we'll go ahead and let everybody enjoy the rest of their day. So kind of a final call for any questions or feedback or success stories.
I don't see anything in the chat.
Okay. Well, I appreciate all the feedback that all of you provided us today, and I appreciate you taking the time to jump on and learn about services throughout Kansas. Obviously, if there's anything we can do to help any of you, please feel free to reach out. I have an awesome team within the Aging Commission at KDADS, and they're all very knowledgeable and super helpful. So I'm sure if you send anything to us, we can get it answered or at least directed to the correct person. And this has actually been recorded, so if you would like to review it, it'll be on the KDADS website later today, so you can re-listen to everything, as well as listen to previous listening sessions. It's all on the KDADS website under state plan. Is that correct, Gabrielle? Is it under state plan?
Yeah, I can get the exact place where it is. So, it's actually under the Mayor's Act. You go to the main page, but I think you shared the URL at the beginning.
Yes.
I'll throw the link in the chat. So
Okay. And then also the Survey Monkey. Anybody and everybody you can think of, we would love to have the Survey Monkey filled out. And again, it goes until March 30th of 2021. So there's a lot of questions directed to services as well as services needed. It addresses mental health. It addresses, I believe, social isolation, and then the general like caregiver and OAA services type of questions. So, but I will let everybody go. Thank you so much for joining. I really enjoyed today's session. You guys have a wonderful day.
Be safe. Happy holidays.
Thank you.